Happy Wednesday Wellness. Woohoo! Woohoo! What are we talking about today?
I think scans.
Why
we
we
do them?
scan?
Why do we do
Yeah.
them? What's so important about them?
Oh my gosh.
Why do we do that? Why do we spend so much money on that equipment?
It's important.
It's very important.
Yeah, because it's very important. Yeah, that's
We scan because
if you know us, you know how much we love to talk about our scans.
And the nervous system.
And the nervous system, exactly. And so our scans show us exactly what's going on in the nervous
and
system.
the nervous
which is really
system is our main system that controls everything in the body.
Yeah.
Literally everything.
It's like our operating system. So like if your computer or your phone has an operating system, if something's off, it's, can mess with your life.
I mean, it controls our digestion, our heart rate, our breathing rate, our hormones, our emotional regulation,
Our immune
sleep,
system,
immune system. Like nothing's gonna function well on any of those.
Our emotions, like
Emotions, I
oof,
know.
yeah.
What's that? Social Vegas.
Social Vegas.
Social
yeah.
Vegas.
Yeah. How we interact with each other in our environment.
Yeah, so
Yeah.
it controls the nervous system controls all those other systems. So if something's going on with the nervous system, those other systems can have things going on with them.
Yes, exactly. And so the standard medical approach is to wait until something's going wrong with those other systems and then doing diagnostic studies to figure out what's going on there.
Blood
Our
work,
approach,
X-rays,
MRIs, yes.
ultrasounds,
Exactly.
or being like,
and then they treat
this
the
seems like a
individual-
kidney. I'm a musculoskeletal doctor. This seems like a kidney issue. I'm going to send you to the specialist.
Yes.
Kidney's like, I don't actually think it's that. I think, I'm going to send you here.
Yes.
So then you're always going
Yep.
to different doctors.
Yeah, or I mean, a lot
And
of
rarely
times
getting
it's
an
like, with kids and stuff, those things are a little more insidious too. So it's like the pediatrician's like, well, they're doing what they should be doing, so nothing's wrong.
Like, they're crying all the time, but that's fine. Babies do that. They'll grow out of
They're
it.
gaining weight, so
Yeah.
latch can't be an issue then. You
Yeah.
know, even if mom's like,
Oh,
"But
babies
my-"
are gassy.
Yeah.
They'll grow out of it.
Yeah, and that's a really tough place to be in as a parent when you're like, I just want an answer for why my kid's so uncomfortable.
Yeah, or like I can tell they're so uncomfortable. Like I want to do something to help them, and that's where we come into play, and why we do our scans, so we can show you, hey, there is reason they're uncomfortable because we can see it in their nervous system.
Yes, exactly. So the tests that we do are all efficiency outcome measures, and really what they're measuring is dysautonomia, which means dys means something isn't working right. Autonomia is our autonomic nervous system, which is all the automatic stuff that we don't have to think about. So breathing, sleeping, digestion, all the things we just covered. So that dysautonomia means there's something miscommunicating in the nervous system.
Yeah.
And so that's our job as chiropractors, to figure out where that is.
Yes.
And we use our scans to tell us exactly where that dysautonomia is occurring.
So we start with our thermography. It kind of shows us where the dysautonomia is,
Yes.
right? Shows
Yep.
where the subluxations are, the dysautonomia, affecting the immune system, the digestive system.
Yeah. So the thermal's showing us like where blood flow is being affected, which all that blood flow is being regulated through the brain, through the nervous system too. So if there's miscommunication happening there, then we'll see changes in where that blood flow patterning is, which is going to change the temperature.
And
in
it
the
can really
surface
help
tissue.
explain why your baby has colic or constipation or reflux, or their kiddo has emotional dysregulation. So can the
Chronic
surface
ear
of
infections,
chronic
like,
ear
yes.
infections, yes.
Yep.
Not draining, chronically getting sick, your
Yep.
older kiddos,
Yeah.
sensory issues.
Because it all ties back to that nervous system
Yeah.
and that dysregulation that's happening there.
Yeah. And then we do surface electromyography.
Yep, so when kids are old enough to sit still, basically, we do electromyography, which shows us how your brain is holding your muscles just in a seated position. So we're not trying to see like how strong those muscles, what we're really trying to see is like how much activity are those muscles being told they need to do to control your spine and control your posture. And so in kids that are like, super hyperactive,
Or
the wild crazy
sensory.
kiddos, sensory kiddos, have a hard time sitting still for those
Anxious,
tests, and that will show up on the scans.
Yeah.
Sometimes moms in their postnatal period will see weakness in some of those
Yeah.
scans too, because their body's adapting to not carrying a baby anymore, or carrying a baby in a different way in their arms now.
Yeah.
And that will all show on those
We
scans
can also
too.
see like
Yeah.
poor coordination, focus challenge. We'll see like not enough activity right, in those kiddos.
Yep, exactly. Or way blown out
Yes.
areas, way too much activity, like way too much sensory
Input.
stuff is coming into the brain. So how can you even focus when you're getting
Yes.
that much input?
And it's cool because we see that, and then they go through care, and we see that all calm down.
Yeah.
It does change.
Symptomatically and
Yes.
on the scans.
Yeah.
Yep. And then heart rate variability is the other test that we do. Heart rate variability is super popular right now. Our Apple Watches
Mine's
measure
always
it.
so bad.
Our Whoop bands the
our
Oura
Oura
rings.
rings.
Yeah, it is like one of the, like, I would say it's kind of like new wave medical diagnostic testing, HRV stuff, because stress is such an important factor in everything.
Yeah.
In any diagnostics, in any just like body efficiency, heart rate variability is one of the most like important factors in how things are going to, in how your body's going to be able to adapt to that. So what that means is like, I mean, if we have really low heart rate variability, our immune system's going to suffer, our sleep's going to suffer. If we're diagnosed with anything, we have worse outcomes because our resilience is lower.
Yes.
So if we have high heart rate variability, all of those things change then. We're able to sleep better, we're able to digest, our immune system's heightened, and then if we have issues or stresses that come into our lives,
We can adapt to them.
we can adapt to them.
We
Yep.
can like get out of that fight or flight.
Yes, exactly. Even like injuries, like you have a better outcome for injury recovery if
Mm-hmm.
your heart rate variability is higher. So it's like looking at inflammation levels, all that kind of stuff. All it ties back to vagus nerve, stress levels in your body, and so that's what heart rate variability is
Important.
looking at. That sympathetic versus parasympathetic.
Check that, and from all those scans, we come up with a nice care plan.
Yep, exactly.
For you.
So that's another part. We don't guess about your care
Yeah.
or what your recommendations are. We have a structure and we have like a system based on like what we're seeing on the scans, what we're seeing symptomatically. We put all that story together and then give what our best recommendations
To get the
based
best
on
results.
all the kids that we see, all the families that we see.
To really change those scans so your body's functioning better, your nervous system's adapting better, so all those other
Yeah.
systems can function better.
Which then just checks the boxes for
Yes.
those symptoms. Yeah. I think we covered it.
I think we covered it.
Yeah.
Our scan. So if you're like, oh wow, maybe maybe you're someone that comes to the office often and you haven't been scanned recently, you want to get scanned, cool, we
Yep.
can do that. If you're a new patient listening to this, or someone who's thinking about being a patient, cool. Like we will do these scans on you, we'll do them on your whole family if you want.
We'll do them for half off since you watched this
This
video.
video,
Yep.
yes, it will give you a lot of insight into how your body's functioning.
One of my favorite patients calls it the adult report card. She was like, I like to see how my body's
Yeah, yeah,
functioning
yeah.
because I mean, it's nice. It's scored, out of 100 points, so you can see like
A, B, C,
okay,
or D.
Yeah, let's get our body functioning as best we can.
Must have been a good student, that patient.
Yeah.
All right, yeah, mention this and we'll give you half off your new exam. Have a great day.
Have a great day.